Megan, I am so thrilled to have you here. I know your journey into this holistic health space and advocacy space surrounding Botox came from a place of personal experience that led to deep research. And what you uncovered is honestly life changing. So, thank you for being willing to share the facts and the hopeful alternatives with us today. Now, personally, I have never had Botox, nor do I ever intend to for many of the reasons that we will discuss today. Though I will say, when living in the city, I lived in Columbus, Ohio prior to moving to rural Ohio within the past year. And it is widely used. You know, if you're at the park with other moms who are in their upper 20s or early 30s or into their 40s, like you can tell when somebody has had Botox just from their expressions and lack thereof. And so I just want all of you to know listening today that this conversation is not meant to be judgmental. If you are somebody who has gotten Botox because all of your friends get it and you feel like that is what you need to do to kind of keep up with the Joneses, for lack of a better word, this is not meant to be judgmental, but it is meant to be educational. And we really want to show you a different perspective and help you understand the risk involved that you may not be aware of, because quite simply, it's just not talked about enough. And then finally, we will dive into holistic alternatives that are really exciting on the skincare front that you can do from the comfort of home. I use many of them on a weekly basis myself to just promote that more grace-filled aging very holistically and without injecting any kind of harmful toxin into your body. So today I have speech language pathologist Megan with me. And Megan, can you just tell us about how you got into Botox and speaking on this as an advocate in the first place?
Absolutely. Thank you so much for having me, Kayla. And as you mentioned earlier, I'm a suburban mom. I go out to the playground too, and I had friends who had been doing Botox for a while. My own sister had done Botox actually quite a few times. Never had a single side effect. In the back of my head I knew, like, isn't that the toxin that causes botulism? But everyone's experience around me was positive. And so even though I was kind of worried, I decided last summer that I was going to try it. And I knew to get a small amount. I just asked my doctor, I just want to try the tiniest amount right here in my crow's feet. And this was a doctor I had actually been seeing for more than 2 years for microneedling, which we can talk about later when we talk about alternatives. But I really trusted her. I had gotten to know her very well. And when I went in last summer, this was last July, she injected me with 6 units, just 6 units on either side of my eyes, and I began having immediate neurological symptoms. The room started to spin. I started feeling a lot of head pressure and brain fog, and it was very odd. But of course, this being my first time, I thought to myself, gosh, is this normal? Is this, I'm just experiencing some side effects. So I voiced my concerns to the doctor at the time. I said, I don't feel well. Is this normal? She brushed me off, said, you're fine, you're anxious, go home. I was supposed to work that day. As you mentioned, I'm an SLP. I go and see patients out in their homes. Well, I only got through one patient that day, and then I just headed home because I had a worsening headache. I was starting to feel like I was coming down with the flu or COVID, and I was getting very dizzy and nauseous. I couldn't care for my children the rest of the day. I'm calling the doctor's office back, like, is any of this normal? Because this is my first time. I don't know what's happening. So I got totally brushed off by the doctor, and this ended up evolving in the ensuing days and weeks into full-on what's called mild botulism. It's not severe enough to kill you. I did survive. That's why I'm here today. But it was truly the most horrific and terrifying symptoms that I have ever lived through in my life. I was having almost daily panic and anxiety attacks because what happens is the toxin actually can disrupt your vagus nerve. And, your listeners might be familiar with the vagus nerve, but
Yes.
it's essentially that nerve that calms the body down and really
Mhm.
helps regulate our body. And it also happens to innervate many muscles that are involved in the swallowing process, in the speaking process, our digestive system. So I had about 10 different symptoms that were all essentially vagus nerve disruption. I I stopped making saliva. I was having incredible difficulty swallowing solid foods. They just weren't going down. My body was rejecting them because they would all feel stuck right around at the top of the esophagus. Constipation, that's a fun one. But severe insomnia. Insomnia to the point where it was 3 a.m. and I was just laying there in bed. And this went on for 2 to 3 months. So I was completely dysfunctional. I was at home. I could not work. I have 3 young kids I could not take care of. My husband took care of everything for months. And I'm sitting there like my life changed the day I got these injections, and I know something's up. But every doctor I'm speaking to is gaslighting me, is telling me it's all in your head, you're just anxious. And sure, I was pretty darn anxious because my vagus nerve was completely disrupted. So I start doing a deep dive into the literature. I start looking at the clinical trials of these drugs. I start looking into support groups. There are many support groups out there for folks who have had these adverse effects after Botox and similar injections. And I just it was like my head exploded. I found this entire world of people who had been harmed by this drug, but because there is no objective, reliable test for botulism, so many of us are being told by doctors, no, 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 it's in your head. This isn't the Botox. And I'm sure as a medical provider, you've probably, at least heard from some of your patients about the gaslighting that can happen in the medical field, or maybe you've experienced it yourself. It's horrific, right? It adds another layer of trauma when you're suffering from something so debilitating as the botulism.
Absolutely.
Go ahead and jump in if you have questions. I talk a lot.
That's okay. That's okay. No, I love it. So you were getting Botox for aesthetic reasons. Is that correct?
Mm-hmm. Correct.
Okay.
It was crow's feet. And when I tell people 12 units, they never believe me. The injectors don't believe me because I say, yes, even 12 units of Botox can cause horrific side effects if it ends up in the wrong place. And what I believe is that I was injected in a blood vessel because I had those immediate symptoms.
That makes sense. It got into circulation. And I have an episode that we talk a ton about the vagus nerve and its importance for that rest and digest portion of your nervous system. And so, yes, absolutely. That makes sense that if that is disrupted, that these symptoms could transpire. Now, did your doctor ever admit to wrongdoing, or was this a hidden side effect that you had actually signed off on and not really realized that this was even an option for you post-injection because it wasn't verbally discussed?
You brought up a great point. So myself, everyone I've spoken to, I hear from people around the world now because I speak out about this and I wrote the books I did about Botox side effects. I hear every single day from people around the world. So many of us are not receiving informed consent. Either we're signing up on a page that says, oh, you could experience headaches and pain at the injection site, but we're not seeing anything about the black box warning that comes with these products. That is essentially a botulism warning on the product label that actually there's 4 pages dedicated on the Botox product insert, and it says, by the way, this toxin can spread into your bloodstream. It can also spread 2 other ways that I'll talk about in a bit. But it can cause botulism. It's been documented to cause botulism. Back in the early clinical trials of this drug, they were reporting that as many as 2 to 10% of patients who received Botox for cervical dystonia were presenting with botulism symptoms in the days and weeks after injections. And, back in the day, so when Botox first started back in the 90s, they didn't have this botulism warning. What they did instead was they just reported these symptoms. Well, anyone who's familiar with botulism could read these symptoms and say, I think I've seen these before somewhere. They're all the same as foodborne botulism. Go ahead.
Can you elaborate on foodborne botulism and what exactly botulism itself is?
Yes, that's a great point. I've been in this world for 10 months now, so I just assume everyone knows. But
Yeah.
botulism originally started as a horrific disease that people were getting from poorly canned foods and poorly preserved foods because it's caused by a toxin that can grow on top of a bacteria that's known as Clostridium botulinum. But essentially, the toxin is what's so poisonous to our bodies. And so if that grows on a bacteria, which it can easily do if there's no oxygen, so it easily grows on like canned foods, people were getting these horrific nervous system symptoms like blurry vision, dizziness, difficulty swallowing, and then eventually difficulty breathing and even cardiac events. So many people that got foodborne botulism back in the day would die from it because they were typically eating a lot of this toxin without realizing it. However, there were a certain percentage of people that would survive and essentially had what was called mild botulism. And that happened about 30% of the time. So they'd get these symptoms for, about 3 to 6 months, and then they'd get better. Well, when you look at the early Botox product insert, and it's reporting these symptoms, they all match up with foodborne botulism symptoms. So we're talking about, I'm actually just going to read straight from the label. Okay, so we have dysphagia, difficulty swallowing, headache, neck pain, and then down here muscle weakness, dizziness, oral dryness, that's a big one I had where your mouth gets really dry, speech disorder, fever, nausea, drowsiness, and then blurry vision and ptosis, where the eyelid goes down, were also reported in 2 to 10% of early Botox clinical trial patients. So, did these marketing executives at Botox know all the ins and outs of foodborne botulism? Maybe not, but because foodborne botulism for the most part had kind of gone away when Botox was coming out because we got better canning practices, more sanitary conditions. So we didn't see foodborne botulism as much. But as we progressed through the 80s, once Botox came out, and the 90s and early 2000s is when people started reporting severe adverse effects after Botox injections.
Yeah, absolutely. And so the Botox that is injected, could you talk a little bit about that? How is that the same or different as the foodborne Botox? And it is getting into the blood system, the bloodstream, the only way that it is infecting people with signs of botulism themselves?
Right, good question. So it is the exact same toxin. They grow it in a lab, but it's the same thing. When it's injected, so let me real quick explain what the toxin does to our nervous
Yeah,
systems. So,
absolutely.
so when we eat it, of course, it gets into our gut, gets into our bloodstream, right? And once it's in our bloodstream, it can go off to certain nerve cells. And what it does is it gets in between two nerve cells in a space called the nerve synapse where two cells meet. And once it's there, it can block neurotransmitter communication. So, what we mostly think about when we think of botulism is that it's blocking acetylcholine, because acetylcholine is that neurotransmitter that tells the muscles to move when the
Hmm.
nerve cells line up with the muscle tissue. But what I've learned through doing all this research, and what scientists have actually known for more than 15 years, is that the toxin can also get into our central nervous system, into our brain, and once it's there, it can block a whole lot more than just acetylcholine. So it can block things like glutamate, GABA, serotonin, dopamine, these incredibly important neurotransmitters that are necessary for proper functioning. And what happened in my case was, I was injected straight into the bloodstream, but the toxin can also spread via essentially adjacent muscle tissue. It can actually diffuse. So if you're injected in the jaw, it can diffuse even further down into the neck, potentially affecting your speech and your swallowing. The third way the toxin can spread is through retrograde axonal transport. And that literally, that's jargon for it can literally hop backwards along the nerve cells. So imagine that you're injected here in your forehead. Well, guess what? That little toxin, whenever it wants, can hop back along the nerve cells that lead back into your central nervous system. And in fact, Botox can't even deny this anymore because there's so much research now that shows that this is happening, that they have a spokeslady out there. Her name's Jean Carruthers. She kind of pioneered Botox treatment for cosmetic use. She's out there now saying that this is a good thing and that this is going to help our depression because the Botox can hop back into our nervous systems, our brains, and start blocking other neurotransmitters. And they've showed this on fMRI at this point. So again, they can't deny it. They're just trying to spin it. They're like, oh, no, wait, Botox in your brain is great.
Right. Spin it a different direction. That's not surprising from the pharmaceutical world at all. So we've talked about the aesthetic uses of Botox. Now, as a physical therapist, I will see patients come into my office who are using Botox for medical reasons. The most common one that I hear of is migraines or TMJ discomfort. Now, I do women's health physical therapy in addition to orthopedics, so I do see mostly women. And a lot of women will carry a ton of tension here, especially in our childbearing years. And so that can trigger migraines or that can trigger TMJ, teeth grinding, jaw pain, right? So what many doctors recommend is Botox injections. And I'm really excited to chat with you about this because I am an integrative dry needling specialist. And so what that means is that I can insert dry needles into people's muscle, fascia, and connective tissue. And a lot of times we'll see a little like jump in the muscle and then it resets and it calms down. And studies have shown that sham trials with Botox, so if they just insert a needle for a placebo effect but do not inject anything, that the person experiences just as much relief or even more relief than what they feel if they are injected with Botox. So just to be clear, let's say somebody's having migraines and they're in a clinical trial. The research study participants will receive either an injection, an actual injection of Botox, or they'll just get a needle inserted into those really tight spasmed muscles. Those who were not actually injected with anything, it was simply a dry needle similar to an acupuncturist needle or a dry needling expert's needle, such as what I use, they received better results. So let's break this down. Let's talk about this in terms of the migraine and TMJ, because that is just mind-blowing, right?
Yeah, it really is. And when you start digging into these double-blind placebo-controlled trials and the big meta-analyses, because you cannot rely on just one study, because guess what? Guess who funds a ton of studies and can basically throw out any study that they don't like the results of? Botox, okay? So you have to look at the big meta-analyses that are done by people who are unbiased, that are coming from either research universities or, maybe they're a neurologist who's trying to figure out what's the best method to use with my patients. And when you look at these giant meta-analyses of Botox for pain relief, so migraines, TMJ pain, you're not seeing great results. The best results they have for the migraines is that on average, it reduced migraines by 2 days a month. And what people need to understand is these are people who have more than 15 migraines per month, and they're getting relief of 2 days, just 2 fewer days of migraines, and at what risk? And what I tell people is if you start looking into the risks of Botox for migraine, you are going to run so far away in the other direction. Yes. We're talking about a 0.1 to 1% risk of essentially botulism with every injection. This is not something you're doing once a year. This is something you're doing 4 times a year. And you can just look, you don't even have to dig for these numbers. You can just go to drugs.com and look up Botox side effects. And what you see for the migraine crowd is that things like the heart palpitations, heart arrhythmias, dizziness, blurry vision, all of these are happening at rates of 0.1 to 1% per injection. You don't want to take that risk. And the reason you don't want to take it is because the manufacturers have never done the research to figure out how long these symptoms can last. I know women, I run a support group now for Botox injured folks. I know women who are going on years 1, 2, and 3, and they still have botulism symptoms from their Botox for migraines. And the TMJ evidence is even worse. The big meta-analyses show absolutely no difference in Botox versus placebo. trials. And I have people comment like, "Oh, well, I have Botox and it relieved my pain." And it's like, that's wonderful and that's great, but that is one of the reasons why we do the big meta-analyses, because we're trying to tease out what is placebo and just like, "Oh, I think this treatment helped me and I feel pretty good." And maybe it is the needle itself that's helping relieve
Right.
tension, right?
Right. Was it actually the Botox that relieved it, or was it simply the insertion of the needle itself and not necessarily what was injected that relieved your discomfort?
Yeah, and I love physical therapists like you because you guys can offer patients an alternative and say, "Hey, here are
Hmm.
the exercises. We're going to do this fascia release, whatever it is," so that people aren't, doctors want that quick fix. They want it. I don't think doctors are bad people. They want to see results, right? They want to see their
Hmm.
patients happy. But these quick band-aid fixes like Botox are essentially just masking symptoms at their best, Most
Right.
of the time they aren't even
Right.
doing that. But at their best, they are masking symptoms that are not getting to the root cause of why do you have tension in your jaw, or why are you having
Yes.
migraines, because migraines are a tricky one. But I really think there are a lot of things we can do to try to reduce our risk of migraines or help make them better. I'm not saying that
Hmm.
I have the answer to cure everyone. I don't. What I do know is just that, or what I encourage people to do, is really look into the potential side effects of Botox and the
Hmm.
data of how effective is it really at pain management.
Right. And the risk reward, I think, is huge here. Both from a medical reason, yes, it's absolutely understandable you want to relieve your pain, but let's look at alternatives, right? Such as physical therapy, such as dry needling, because there is so much that we can do and educate you on what you could do from the comfort of home versus being reliant on going to your doctor every 3 months for an injection that has huge side effects. Now, Megan, let's jump back to the timeline because when you personally had botulism symptoms, how long did it take for this to get out of your system? Did you do anything that you feel like helped clear it to get you back to your typical baseline? How did that all proceed?
Yeah, it's in order to understand healing from botulism, you have to understand how the toxin works. And the toxin, once it attaches to those nerve synapses that I mentioned, it does not leave. So what happens is your body starts to regrow new nerve synapses around the ones that are permanently damaged by the toxin. So anyone who's had Botox injections actually technically has permanent nervous system damage. What happened
Wow.
is your body regrew new nerve synapses. Now, what we know from, they've done studies where they're able to look at these new nerve fibers that regrow. They're never quite as strong and
Yeah.
as effective as the old ones. So
Hmm.
what happens when the toxin goes systemic, unfortunately, is people end up with this damage that tends to heal. It depends on how moderate to severe the disease is. I was incredibly lucky, Kayla. I had 12 units once. I got like the most mild version of botulism ever, and it
Okay.
still derailed my life for about six
Yes.
months. But I
Wow.
would say that it took, each symptom kind of came in waves, and they would each take about 3 to 4 months to remediate. What I still struggle with sometimes is I did end up having ear nerve damage that resulted
Wow.
in congested ears 24/7 for about 4 to 8 months. And then, it slowly got better and better with time. Sometimes it comes back. I also, again, back to that vagus nerve, I still get those just kind of like anxiety rushes is the best way I can describe them. So I've just noticed things about me where I've become one of those people that has to like tap their feet all the time. I was never one of those people, but you know what I'm talking about, right? Or
Hmm.
and my husband's noticed certain things about me. He's like, yeah, you do interesting things now. Like you can tell that my nervous system is not who I was before the Botox, but I am very functional. The brain fog and fatigue cleared up relatively fast for me. And once it did, I was like, that's it. I'm writing about this stuff
Yes.
because I was just so floored. I ended up meeting a researcher who's been studying botulism forever in one of these support groups, and she was telling me about the history of Botox and how often these adverse effects are happening. And I just thought, someone's got to write about this, because the sad reality is, Kayla, that a lot of people who are damaged by Botox end up taking years to heal. And I don't want to sugarcoat that. That is the true reality for many people.
Yeah.
What happens in some cases is it can trigger new conditions. It can really attack the thyroid. It can trigger something called MCAS. I'm not sure if you're familiar with that, the mast cell activation. It's essentially an immune response where the body
Okay.
becomes hypersensitive from having to fight off this toxin. But, ultimately the toxin stays where it goes in your body, and your body regrows, your body regenerates over time. And it is just, a lot of it is up to luck. In my case, I was so healthy going in, and I'm so lucky that I was. I didn't have any prior health conditions. So I do believe that helped me heal relatively fast. I am like you and probably a lot of your audience. I eat all the organic foods, nutrient-dense foods. I take my sleep very seriously once I was
Mm-hmm.
able to sleep.
Yeah.
Grounding outdoors, getting sunlight, all of the things that help support a healthy body
Yes.
is what I did. There's no pill, there's no quick fix for
Mhm.
botulism.
And I think that's
It's
an important note, because I talk with my patients and my community here on Holistically Well a lot about we need to minimize toxins going in, but we also need to optimize these pathways for getting them out of our system, because just by living life, walking around through a downtown area or, wherever you are at, we're going to be exposed to toxins. There's pollution in the air. There are pesticides played on farm crops, and we need to just optimize these pathways for getting it out of our body. So sauna use can be great, grounding, as you said, exercising consistently, diaphragmatic breathing. So just kind of all of those big picture lymphatic drainage techniques are what you followed, because like you said, it's just clearing it from our body in that way, but there's no special pill or drug or specific treatment approach that's been uncovered yet. Is that correct?
and yes, and I do want to add, you can probably put this in your show notes, but I have a website that people can log on to if they have experienced these effects or if they know someone, because there are certain things that are important to stay away from actually when you're
Okay.
healing from botulism. And unfortunately, three of those are some fun things like acupuncture, chiropractic, and massage. And the reason,
Interesting.
yes, it's very interesting. And the reason we say that is because a lot of people have had a worsening of symptoms after these techniques because they are affecting the nervous system. And we're not
Mm-hmm.
sure exactly why, but it could be that the massage is further spreading the toxin, like
Yeah.
literally.
Mm-hmm.
Chiropractic and acupuncture seem to be doing something where it triggers the nervous system to act, but it's almost like overreacting now because it's
Mm-hmm.
blocked in certain areas. So I just want to mention that just in case anyone's listening. They can definitely head to my website, which is just iatrogenicbotulism.com, and they can read more about specific things to just be sure to avoid if they're still having botulism symptoms.
I am so glad you mentioned that, because dry needling that I utilize, similar technique as acupuncture, but our mode of treatment is different. Same tool though. And so from my standpoint as a practitioner, the reason it might worsen symptoms is because we increase blood flow to the area. So we promote healing qualities in the area. But to your point, if it is attached to your nerve cells, and our whole approach with inserting a needle is to increase blood flow to the nerve cells to help the nerve repair and heal. Well, when that nerve that has the toxin attached to it repairs or heals and kind of replicates, essentially, it's actually replicating the Botox as well. It
It
sounds like,
could,
and there's not
it,
specific trials on this. We don't know exactly why, but just from my standpoint as a practitioner, I'm like, that would actually kind of make sense.
yeah. And what it's most likely happening is the nervous system is, if you're blocking neurotransmitters on certain nerve synapses, then the ones around it that are still working might overreact and might, if you're stimulating those via acupuncture or needles, they might tend to just kind of overfire and you might end up with different symptoms. The reality is, Kayla, no one is doing research on this. There
Right.
was one neurologist. I have to mention this because this is going to people's heads are going to explode when they hear this. There was one neurologist who actually had a patient who developed iatrogenic botulism. She was so surprised. She had never seen it in her career, but she decided instead of gaslighting that patient, she was going to do research on people like me. And this woman was truly my hero, and she was doing research back in 2016, 2012, that time frame. She was corresponding with people who have iatrogenic botulism. She published multiple papers on these side effects that can happen. I mean, she served as an expert witness in one of the big Botox trials, and we basically haven't heard from her since. And two little
Okay.
birdies told me that, a certain pharmaceutical company didn't like the work she was doing. So I can't say more than that on air, but,
Right.
it just goes to show you that the doctors that are brave and the doctors that speak out about this kind of stuff, they often don't last very long. And that is
Yeah.
because the pharmaceutical industry is so powerful when it comes to funding
Hmm.
research at universities. They can easily, just smear a doctor's entire career.
Hmm.
Um, and so I think people need to know, well, why am I not seeing any of this on Google when I search Botox side effects, right? You're seeing headache and pain at the injection site. You're not seeing the devastation that has occurred. And that is because a lot of these companies have the power to just kind of quiet us down and
Yes.
look the other way, public. You
Hmm.
don't see a news story about us. There are starting to be more and more podcasts coming out and talking about this because it's the one way they can't shut us up.
Right,
But
right. Free speech.
yeah, that's right. So, and I hate to sound,
Yeah.
I'm not trying to sound too tinfoil hat. I'm not saying these side effects
Yeah.
happen to everyone. What I'm
Hmm.
saying is they can and do happen. And in fact, they're
Right,
listed all over the Botox product insert, right? So of course they
right.
happen. The FDA just last year received over 600 reports of death after these
Wow.
injections. And we know that that's probably what, like 10% really of what is really going on. So many people aren't putting two and two together. They aren't
Right.
correlating the side effects back to the Botox. If I had $1 for every woman that's told me, "Oh my gosh, I was having severe anxiety, I was having brain fog, I was having dry eyes and mouth, difficulty swallowing, and I never correlated it to the Botox
Right.
until I stopped doing the Botox and they all went away."
Hmm.
So, I mean, I'd be
Yeah.
rich. That's the point. If I had a
Yes.
dollar, I'd be rich. So,
Before we dive into natural alternatives to Botox, I'm curious for those who are currently having Botox injections, how do they stop? Like, do they cold turkey stop? Is there a wean out? Like, what is the optimal way to stop and then to optimize your system moving forward?
cold turkey. Cold
Hmm.
turkey 100%. Do not, in my opinion, do not take the risk. I mean, having lived through this horrific illness, having met so many people around the world who have lived through this, there's no withdrawal from
Hmm.
poison. No, I'm
Hmm.
kidding. But you cold turkey stop. The effects wear off within 2 to 3 months.
Right.
So if you just never go back, you never go back. You have done damage to your nervous system if you've had Botox injections. Consider yourself extremely lucky if you haven't yet had horrific side effects, and just cold turkey stop and start listening to people like you, Kayla, who have all these
Hmm.
amazing alternatives. Because
Yeah.
I tell people it's 2025, ladies. Like, there are so many amazing alternatives to keep our skin looking healthy and
Hmm.
youthful and that are truly promoting full body health, right? Because
Correct.
Botox is not, I mean, they I have to mention this. Sorry, I'm all over the place, but 2025, they just came out with a study showing botulism toxin in women's breast milk who were getting it for
Mm.
forehead lines. This stuff is spreading in your body. Regardless of what your injector tells you, it's just that for most people, it may not be a large enough amount for them to notice effects right away, but it compounds over time and it is spreading throughout your bloodstream. It just
Absolutely.
is.
And yeah, and anytime something is not allowed during or not recommended during pregnancy or breastfeeding, I'm like, let's scratch our head and ask ourselves why we can have it other times. Like a lot of times if it's going to be toxic to baby, it's probably toxic to you too, you know?
Yeah,
So
Absolutely.
let's talk about natural alternatives. And I'm excited to hear your thoughts on this. And then I definitely want to provide some that I use and swear by too.
I know. I'm more excited to hear your thoughts. So before I tried the Botox, I did something called microneedling, which I
Hmm.
love, and it sounds a little bit similar. I mean, the idea of the microneedling is that you're creating like essentially micro injuries and then you're boosting your skin's natural collagen and healing process to,
Right.
regenerate the skin in those injured places, injured. So I was doing microneedling for a while. I wrote down some other things. A lot of women are doing face taping, which can be a great way to
Right.
just keep stuff still at night. The
Right.
frownies and the
Yep.
silicone stickers, I do those a
Hmm.
little bit.
Okay.
Um, I am just like a whole body person though. Like I'm a big believer in, are you eating healthy fats? Are you getting
Hmm.
a little bit of sun on your body? I personally choose to like wear a hat and high neck shirts just because I don't want more sun damage on my face and chest. But I
Okay.
get sun on the rest of my limbs because I'm a believer in vitamin D. I eat collagen powder. Um, what else? There's red light therapy that some people
Hmm.
do. And, a lot of it too is just the acceptance of course we're going to age, and
Yes.
just coming to terms with that. And I look at my mom, she's the most beautiful woman I've ever met, and she's got every wrinkle in the book. Like the
Right.
wrinkles aren't what
Right.
make you beautiful, right? It's much more about who you are as a person and your spark, so to speak, and your glow. So I always encourage women, like the number one thing is just that ultimately accepting that this is who we are going to age, but
Hmm.
also taking good care of our skin via, maybe avoiding extra sun exposure on our face and neck and doing these things like microneedling. The acupuncture for wrinkles sounds really interesting, and I want to hear more about that from you. So,
Yeah, yeah. So when I lived in the city, I would do facials kind of every 6 weeks because it was very accessible. Now that I've been in rural Ohio for almost a year, I have not. And it's only been things that I'm doing from the comfort of home now because it's just not easily accessible. I have three little ones, scheduling the time for that appointment for aesthetic reasons only is just not a priority. And I don't do frownies. I to your point of aging gracefully, I mean, it's a gift to age. And so to me, I my goal is not to have zero movement on my forehead. Like I'm okay with a little bit of movement there. I have a little line there that I get, and I did not do my gua sha there this week, and so it's like more noticeable. But usually when I do my gua sha consistently, I am able to get this little line here to go away, and that's awesome. And it's a gua sha tool. I use one from Primally Pure. And is their black stone. It has some extra curvatures than their green stone does. Code Dr. Kayla will give you a discount code on Primally Pure always. And I use that for fascial release. I start down at the jaw to kind of open that up, the neck, the cheek. It kind of lifts through the cheekbones. And then I make my way up to the forehead. And there is a ridged line on their gua sha tool that you can move perpendicular to any kind of fine lines or wrinkles that you have. And what you feel is tension. You feel the tension beneath the surface. And that tension is there from those muscles activating throughout the day. And that's why frownies work because to your point, they're kind of freezing things there at night. And so as you're making expressions as you sleep or as you're scrunched up on your pillow, the skin is just flat and you're not getting those tension lines. So I will use the gua sha tool to essentially massage those out, to release them, and then it smooths everything over. It truly does. And so for me, I'm 33 years old. I'm certainly in that season where a lot of my peers are choosing to begin Botox or maybe already have because they're like, oh, I'm noticing some lines. I want those gone. But it's a gift to age. And to your point of thinking about your mom, I think about my grandma. My grandma lived into her mid 90s and she had so many wrinkles on her face, but it was from a face that told so many stories and a life well lived. And she was beautiful. Anybody who knows my grandma, she just was absolutely stunning. She was always tan. To your point of loving vitamin D, I mean, she was in that generation that would put aluminum foil on like cardboard and reflect the sun back at her face. So there was like no sun protection.
Gosh.
And so, it told her story. And I think we're losing that in today's generation because everybody wants that total clean slate that doesn't show any history of our life. And I think that's sad. And I think that's sad for that next generation, to feel like we have to hide from aging for our daughters. I want my daughter to see me take care of my body, to your point, from a holistic lens of, getting out and grounding, getting vitamin D on my skin first thing in the morning, getting that sunlight on my eyes, ingesting collagen. I use collagen powder in my coffee and MCT oil in my coffee for your point of a healthy fat. We eat clean, organic foods mostly so that we're limiting any kind of toxins going in, because your gut lining can certainly affect what we see on the outside when it comes to skin. So if you're somebody who struggles with acne, that would be something to look at, would certainly be your gut health. But yes, holistic alternatives to home, kind of got on a tangent there, but the gua sha tool, I love using like 2 to 3 times a week, if not nightly, if it works out. And then cupping. Facial cupping is an awesome alternative as well. That's going to stimulate blood flow and collagen production to your skin. And then the suction actually kind of separates those layers. So if, again, you have that tension in your jaw or in your forehead, it's going to pull that apart and ease that. And so this can be for aesthetic reasons or for pain. So for clients struggling with TMJ, facial cupping, absolutely wonderful. And then for clients struggling with migraines, I like using that gua sha tool on the base of the neck where our suboccipital muscles are and help relieve tension there. So those are all strategies that can help both from the aesthetic end, but also from a pain standpoint.
Wow, I'm learning so much. We're learning from each other, Kayla, because I do have a facial cupping device and I love using it. It's just fun,
Yes.
And
Yes.
you get that nice healthy glow after you use it. You can tell the blood flow. But I'm going to start using it on my jaw because, believe it or not, because of the damage I got from the Botox, I actually got TMJ pain. My ears were clogged every single day for 4 months. So I was moving my jaw in the weirdest ways possible, trying to unclog my ears. And I ended up with a ton of tension in my jaw. So I'm going to take that cupping tip.
Absolutely. And just a real quick note on the acupuncture or dry needling. We use it for pain points, as I mentioned, migraines, TMJ, discomfort, but there is a moving body of research pointing towards its use for aesthetics. So that is something I have not fully dove into yet, but currently I'll use facial dry needling. Again, same tool that acupuncturists use over the sinus cavities to relieve congestion there. So it'd be a similar kind of approach, but you're going into those areas where that buildup of tension is in your fascial wall and placing the needle there to kind of break up that tension and increase blood flow, promote healing properties, all of that. So something that I haven't dove into a lot yet, but I'm kind of interested in being my own guinea pig and seeing how that transpires.
Yeah, that sounds fun. And just to bring everything home, I would just say to women, because we have all of these amazing alternatives, we can look at something like Botox and really dig into the side effects and just say, you know what? Not worth the risk, especially if you have young children. Both of us have 3 young kids. Trust me, ladies, you do not want to go through this having 3 young kids. It was horrific. And I really just encourage I tell every woman I meet, I'm like, don't do Botox. Because man, if I had even just heard one story like my own before I went in that day, I would not have taken the risk. And so that's what I'm trying to do, is just raise awareness through my website, through my books, trying to get the word out, because I really think, if people heard more about our stories and people who have suffered so much after these drugs, they wouldn't take the risk. They would go for these amazing alternatives instead.
Megan, where can my community follow up with you if they want to learn more, if they want to read your books? How do they get their hands on it?
Yeah, so my website is just iatrogenicbotulism.com. You can put it in the show notes so I don't have to spell it out.
I will.
But iatrogenic essentially means like caused by the doctor or man-made, So it's man-made botulism. And then I do have a couple books on Amazon. My one that is about the history of Botox and its adverse effects is called No Tox, and then I wrote another book that's just for medical professionals, Iatrogenic Botulism 101. There was not a book out there about this disease, and I really felt a calling to put a book out that explains to doctors, here's all the possible side effects, here's how to help your patients if they present with these, just because so many of us who have suffered have really had a hard time getting help. So I'm also on Instagram at Botox Truths, and that's where I post, my version of funny reels, etc., trying to raise awareness. But that's where they can find me.
Amazing. Well, thank you so much for your time today. I hope that this helped you, the listener, to pause or think differently. I'd love for you to share it with a friend or leave a review. These conversations truly matter, and so do you. So thank you for being here, and thank you for the time to dig deeper. Until next time, take care and be well.